Hello, thanks for listening to the Total Knee Tips and Pearls podcast. This is Adam Rosen, your host. I'm a fellowship-trained orthopedic surgeon who specializes in joint replacement. In these episodes, I'm going to share with you a lot of my tips and tricks and review classic articles and current implant designs. Thanks for tuning in, and on with the show. Hello and welcome back. This is Adam Rosen, and you're listening to the Total Knee Tips and Pearls podcast. We're going to continue on with this fourth season with different episodes on classification, and this one is sort of timely just because of the unfortunate recent passing of Dr. Larry Dorr, who put together this classification. And, you know, he did so much for people, was involved with Operation Walk and teaching and education and publishing. They're just a heartfelt thanks to everything that he has done, you know, for people worldwide and also our community of orthopedic surgeons. So this classification, you know, which bears his name, was first published in Bone in 1993, and it was entitled Structural and Cellular Assessment of Bone Quality of the Proximal Femur. And to be honest with you, I've never calculated these. So it's good for you to know that when he looked at this, he looked at a lot of the radiographic findings on the AP and lateral radiographs and looked at the canal to calcar ratio, what's called the CC ratio, and looked at the cortical index, the CI, the canal flare index, the CFI. You know, and if you're looking at sort of the buzz terms, you know, if you need to know these things, you know, we're talking about the classification of the femur, either ABC. You know, when you're looking at this ratio, A is less than 0.5, B 0.5 to 0.7.5, and C is greater than 0.7.5. Okay, so what does all that mean? So ABC, the different types of femurs that you may see. So a type A or Dorr A femur has a very thick cortice. And this is your typical sort of champagne flute femur. And also when you talk about, well, what does this mean? There's been a lot of studies that have come out and looked at, well, what does this mean as far as implant choice? You know, this is one that is typically a good choice for a press-fit implant. Now, just understand that not all press-fit implants are the same. So this is where you could easily have, you know, what we would consider distal potting or a mismatch. So if you're using like a long Riemann broach stem, you may have a larger diameter up top, but you're getting incarcerated distally. So you don't want to leave it potted distally and not have fixation proximally, especially if that's where the load is going to be born, which means that you may have to ream away good cortical bone distally. You know, the other option are some of these blades or these shorter stems that are tapered and metaphyseal engaging. You know, but just understand that when someone says, yeah, this will accept a press-fit implant, it doesn't mean it will accept all press-fit implants well. So that's your type A or Dorr A femur. Now, Dorr B femur is thin cortices with this residual funnel shape of the femur. And again, typically press-fit implant may be utilized. Now, again, in America, we're a lot more apt to press-fit a lot of our hips, where there's great data elsewhere that shows that cemented implants work very, very well for all kinds of femurs. But this is just kind of going along that these are sort of your options as far as suggested based on the bone morphology. And then a Dorr C femur, this is a very thin cortex. This is your typical, you know, stovepipe canal. And this is one where typically a cemented implant is recommended. Although there have been some studies, you know, that have looked at what type of more modern press-fit implants may be suitable and what the outcomes are for these Dorr C femurs. But a testament to Dr. Dorr, you know, he was a lot more than just, you know, doing the procedure. He was a true scientist and a clinician. So, you know, when you go back and look at this article, it was interesting because, yes, he looked at the x-rays and looked at all of these ratios, but they also drew blood. And they looked at the calcium, and they looked at patients' parathyroid hormone levels and vitamin D levels. And then they also took the bone and they looked at histologically and histomorphologically. And they looked at all of these things to really look at what was going on at the bone level with these different things that he was seeing. But the important, takeaway as far as, day-to-day useful information that you may be utilized or questioned about is this Dorr classification, first proposed in 1993. And 3 types, Dorr A, B, and C femurs. Dorr A is your thick cortex, more of that champagne flute-looking proximal femur. Dorr B femur is thinner cortices, but you can still make out the residual of that funnel shape. And a Dorr C femur is thin cortex, your typical stovepipe canal. And I will put, again, all of those briefly in the show notes for a quick reference for you. Until next time, stay safe. I'm Adam Rosen. You've been listening to the Total Knee Tips and Pearls podcast. You've been listening to the Total Knee Tips and Pearls podcast. Make sure that you're subscribed so you'll be notified of future episodes. And please take the time to leave a review. It helps other people like you find the show. Until next time, stay safe.